Video. There we are. Okay. Right. Oh, we're at Fernihurst Nursing Home in Exmouth today, and this is Holly, the Deputy Manager.
Hiya.
Holly, just to confirm, you've consented to the film to be
Yes.
taken and the contents and us storing it according to GDPR?
Yes.
Okay, brilliant. So Holly's going to talk to us about her experiences that she's had with student nurses at Fernihurst. So first of all, what's the positive aspect of having student nurses?
Well, we found from the 2 nurses we had that they brought a lot of new research to the home.
Okay.
Although we keep up to date with things, obviously they have more reach to it all with attending university lectures. They also challenged, the nurses professionally and questioned things. They were really helpful with the staff. Their morale was really good because they're keen to learn and to do things, so it was sort of a boost for the staff as well.
Brilliant.
They built really good relationships with the residents and the relatives, and it's just nice to see that when they finish their placement that they're happy coming here and they like being here. They give us good feedback, and the 2 of them actually applied for positions as bank carers, so they're now working for us in a bank situation.
Oh, that's fantastic.
But yeah, it's just lovely to know that our nurses are giving something back to future nurses.
Yeah, and encouraging more nurses into social care.
Yeah, definitely.
Hopefully.
It's a difficult job. It's been a difficult 3 years with COVID. There's a lot of negative feedback about care homes and social work, but actually they were very pleasantly surprised. And yeah, I think it was something that they'd consider going into when they qualify.
That's fantastic.
Yeah.
Okay, can you explain what types of work experience the students were involved with?
Okay, so depending on their year of their training and whereabouts they were in terms of the goals they needed to complete, that affected what we encouraged them to do. So one of our nurses, she was a first year student, so hers was mainly medication management, so we helped her and supported her look at all the different types of medication we use for our types of residents, shadowing her doing medication rounds, the ordering and storing of medication, liaising with the pharmacist and our clinical pharmacist who attends the home to carry out frailty reviews of residents with their medication. The other student was a second year student, so we encouraged her to do more dressing based, more aseptic techniques. She did more care plans and risk assessments, more of the delegation of the shift and handovers. So it was mainly about finding what their goals were, seeing how we could meet that in the time they were here and in a safe way for our residents and our other nurses, and then making a plan and just going from there. And obviously we wanted to encourage them to take on roles that they hadn't necessarily done before, but to build their confidence. So, supporting in taking bloods, so they would shadow nurses taking bloods, and maybe they would go away and research information about what the readings meant or different things, and then come back the next day and give us a handover on what they found. So there was just lots of different ways that we got them involved. We got them involved with care, the nursing side of things, the MDT meetings we had with the GPs, the older people's mental health, but then also we allowed them the time that they needed to go away and research it on their own, but then they'd come back and they'd give us feedback on what they found out.
Oh no, that's fantastic.
Yeah.
Loads of opportunities there for students.
Yeah.
Okay. What do you think they found most beneficial?
I think probably being quite hands-on. Obviously working in social care, it's very hands-on. Our residents are all dementia residents, so they need a lot of support and a lot of anticipatory care. And I think our students benefited from having that, because then they had to really build rapport with the residents, they had to build that level of trust. They needed to utilise their person skills to get a task done without making it feel like a task to the resident. And you can't learn that in a classroom.
No.
And I think that's what they benefited from, was because then come the end of their time with us, they had such a good therapeutic relationship with the residents that they actually found it sad to be leaving. And you don't get that necessarily when you're in a GP surgery or you're on a busy ward. You don't always get to build those relationships. So I think it was good for them to have that experience. And
I guess it's a different approach to person-centred care, isn't it?
Yeah.
A whole holistic approach where you're seeing someone right through the process of caring for them, and they don't necessarily get that experience in a hospital setting.
Yeah, because you could be doing anything from assisting them with food, fluids, continence care, dressings, or taking them out for an appointment. So you're supporting them with everything, not just one aspect of their day. It's supporting them with all of their daily activities.
Brilliant. Can you tell me a little bit about the shift patterns that they worked and how you managed that?
Yeah, so I mean, in social care, in particular in nursing care homes, there's always this sort of stigma that you have to do a 12-hour shift. But here at Fernihurst, we're really flexible. We try and encourage people to come into the care side of, nursing to work, because it is really beneficial, it is really rewarding. But people can't always do those 12-hour shifts. So we offer flexible shifts, so we've got mums who might need childcare issues, so they'll work 9 till 3 Monday to Friday. Some of our nursing students did 9 till 5 Monday to Friday, and then would go home, do some research at home that we've planned for them to do, bring it back the next day and give us feedback. We do split shifts, or we'll do 10 till 10. We try and make it person-centred for the staff, because the staff have to be happy, and they have to be full of energy. There's no good them coming here if they're tired, because the residents pick up on it and then they're not getting the level of care they need. So we try and make it person-centred for the staff as well as the residents.
No, that's fantastic. Ethos. Yeah. Brilliant. So a little bit about the time of a practice supervisor and the time for a practice assessor.
Yeah.
Could you explain a little bit about that?
Yeah, so we had 2 students at once. I mean, we have minimum of 2 nurses in the home running the 3 floors, and obviously myself, I'm a registered mental health nurse, and Catherine, the home manager, who's a registered nurse. So we're here Monday to Friday. So between, say, 4 nurses, and even on a weekend when there was only 2, I've had no concerns raised from any of my nursing staff that having a student was a hindrance or an issue or anything. If the training that you need to do to become the assessor and the supervisor takes probably an hour. You do an online course, so that's not time consuming in itself. Having a student, the benefits of having a student outweigh the time it takes in shadowing them and training them. And we all start somewhere. We all need that time to learn. It does take a bit longer with medication rounds, but then that's not a bad thing, because then you've got time to really show your knowledge and skills to somebody else, and in years to come, when that person's trained, you might be the nurse that they remember and think, wow, she really made a difference.
No, that's really great.
Yeah.
No, that's absolutely fantastic. And what about the recording documents? Was that quite easy, the EPAD?
Yeah, the EPAD was really brilliant. Both student nurses were very organised. They both turned up with all of the things that we needed. I mean, we keep a folder in the office for both universities that we supported that have got their policies in. It's got all of their induction paperwork, so we've got that ready for when they start. So we go through that with them on the first day, make a plan of everything that we're going to do, and then they come with their EPAD or their printed out paperwork. They're fully aware of what they require from us, which makes it so much easier. And then we sit down, have a cup of tea, and we'll go through everything that needs to be done.
It's quite student-led then?
Yes, yeah. And they're motivated, they're very motivated, which helps.
Yeah, that's brilliant. It rubs off on staff a little bit as well, doesn't it?
Yeah, it does, yeah.
Okay, thank you. Is there anything else you'd like to add about the experience at all?
Just that I wish we started doing it sooner, to be honest with you. Yeah, because it's been really lovely. And the feedback we've had from them, it's good to show our relatives, and it's good to show our residents and the other staff, and it's just nice to know we're helping potential new nurses. So yeah. And
you're going ahead this autumn with more students?
Yes, we are.
And next year?
Yeah. We're hoping to branch out and get different types of students in.
Yeah.
But yeah, we're very excited.
That's fantastic. Thank you very much for your time.
That's okay. Thank you.
She'll have to cut this bit out of me.